Hi everyone, and welcome to another episode of the Afya Health and Lifestyle Interview Series from the Agbari Multimedia company. At Afya will be inviting well-seasoned health specialists to inform you on certain medical conditions, debunk some of the myths you must have heard about these conditions, and give you actionable tips to better health. If you're new here, welcome to the channel, and if you're a returning subscriber, thank you for stopping by again. We appreciate and see you. So today on the show, we're going to be talking about glaucoma. I know some of you must have heard about glaucoma, but let me just give you a little bit of background information. Glaucoma is an eye health disorder. It's an eye disorder that causes blindness. And if you're interested in knowing how to prevent it, I brought just the healthcare specialist for that in the person of Dr. Halima Alimi. She's going to be telling us everything we need to know about glaucoma, the types, the causes, the prevention, and everything in between. So let me introduce her now. Dr. Halima Alimi hails from Kogi State, Nigeria. After completing her primary and secondary education at Command School, Kaduna, she obtained her MBBS at Ahmadu Bello University, Zaria, in 1992. Dr. Halimi had her residency training at the Lagos University Teaching Hospital, following which she successfully passed the final examinations of both the West African and Nigerian Postgraduate Medical College and obtained FWACS 2003 and FMC Opt in 2005, respectively. She had a subspecialty training in pediatrics, ophthalmology, and squints in 2019 at the Isfahani Islamia Eye Institute and Hospital, Bangladesh. She established and has been the medical director of the Anur Eye Center, Surulere, since 2003, a center that specializes in adult cataract surgery, glaucoma management of pediatric surgical conditions such as cataracts and squints, and many other medical ophthalmic pathologies. She's married to Dr. Mustafa Alimi, the MD of National Orthopedic Hospital, Igobi, and the marriage is blessed with 3 children. Hi, good day, Dr. Halima.
Hello, everyone. Good to be here.
Yes, yes, thank you for obliging our invite, ma.
Yeah, thank you.
Yes, would you like to say hi to the viewers?
Yeah, hello, everyone. Good to be here. I hope everyone is keeping safe.
Okay, thank you very much. So without further ado, I'll just get to it. My first question, having read through your bio and seen your background and all your story so far, why ophthalmology? I mean, there's so many specialties you could have, so many other areas you should have branched to after your MBBS. What led you towards ophthalmology in particular?
Yes, absolutely. Thank you. I always love to answer that question. You know, in medical school, you go through many different postings. And so in the course of exposure to different branches and arms of medicine, something calls to you. And it was love at first sight with ophthalmology. It was such an interesting mix of things to look at. So whereas if you looked at general surgery, for instance, it's mostly strictly surgeries, and if you looked at medicine, it's strictly medical things. But ophthalmology was a beautiful mix of medical, optical, surgical. You just never know what was going to come along. And so there's a beautiful variety of things to see and things to do. And it was such a nice, neat path. It just sort of, calls to me. And I found the staff also, I don't know if it had anything to do with ophthalmology, but I found the staff in ophthalmology to be the most pleasant people in medical school. And therefore, that just drew me. It was a total thing. And it's, apart from my family, I think ophthalmology is the next love of my life. I don't know what else I do with medicine. If someone asked me to quit ophthalmology now. So yes, ophthalmology is it.
Okay, thank you very much for that answer. Now, Ma, I feel like even I am sold. If I had a chance again, I would probably go for ophthalmology. Thanks to your introduction and why you went for it. And following up on, I feel like there's even this misconception around how people wearing glasses are smarter than the rest of us. So.
No, I'm afraid not really. It's an age thing. So some people have eye characteristics that, would mean they would wear glasses from a young age. But even if you never needed glasses as a youngster, it beckons when you get to a certain age. If you live old enough, for long enough, you will wear glasses. In as much as you look at anything, yes, especially your reading. So no, it's not a factor of cleverness at all.
Okay, thank you very much for that, Matt. So the next question will be, so we're going to be talking about glaucoma, but I feel like some people don't even know what this is. They've probably just heard it or seen it on posters. So I want you to give our audience or tell us more about glaucoma, background introduction to glaucoma.
Yes. Thank you for bringing on a topic like glaucoma. We can never speak, enough about glaucoma. It's a big problem. Glaucoma is a group of diseases that lead to a destruction, a damage of the nerve of our eyes. And so this leads to blindness eventually, if not discovered and then put under control. So basically, just for that background understanding, our eyes are kept inflated by fluid circulating within it in much the same way as a balloon is inflated by air. Now, this fluid has a production point and an exit point. So what happens with glaucoma is that angle in the eye where there's an exit of this fluid, for some reason, is blocked. For one reason or the other, there's partial blockage or total blockage, and you're not getting this drainage. And when this doesn't happen, there's a net excess of fluid left in the eye because production continues. And so if you have continuous production, defective drainage, you're going to have excess. So this excess fluid in the eye is what exerts pressure, which affects the nerve of our eyes. So when you have high pressure in the eye, it dams back the blood supply to the nerve. And this nerve is a connection between your eye and your brain. So once it can't take messages back and forth between the eye and the brain, you can't see. Your vision begins to deteriorate. And so this is what glaucoma is. High pressure affecting the function of the nerve of the eye. And it's potentially blinding.
Okay. Thank you very much for that, Ma. So high pressure that obstructs the pressure then damages or threatens to damage the nerve. Okay. So the next question will be, so when we say things like this and other health conditions, people usually have this feeling that they are abstract, or maybe because they feel like it does not hit close to home, or they just see it in the news. Can you let us know, like, what is the prevalence of glaucoma globally?
Glaucoma is the commonest cause of irreversible blindness in the world and in any community you look at. You can look at blindness from the point of view of reversibility, treatability. You have to ask yourself, if a person goes blind, can you bring the vision back? So cataracts, and I'm sure most people have heard of cataracts. Cataracts are the commonest cause of reversible blindness. So if a patient comes to you with a cataract and you extract the cataract, they'll see again. But for glaucoma, it's not the same thing. It's the nerve of the eye, and the nerve of the eye is like a light cable. You know, once your cable is blown, it's blown. And so the nerve of the eye is very much like this. And so once a person goes blind from glaucoma, it's irreversible. That's it. It's permanent. And so glaucoma is the commonest cause of irreversible blindness in the world. And at this time in the year, about last year, by year 2020, it was estimated that worldwide, 80 million people have glaucoma, of which about 11 million are blind. Try and imagine, that's staggering statistics. 11 million blind people, irreversible. And it has been projected that from 80 million sufferers, that in the next 20 years, there'll be over 100 million, sufferers from glaucoma. Of course, you can project that the number of blind will increase as well. So it's a big problem. Again, in Nigeria, studies have been done. Glaucoma is also the highest cause of irreversible blindness anywhere in the country. And so it's a big problem. It's certainly very significant and it's worth looking at. And we all need to take note of it and make sure it doesn't happen to us.
Okay. Yes, thank you very much for that, Ma. Yes, there is a slide. This slide will be able to paint a better picture for the audience.
Yes, just to sort of keep people in the loop about what we're talking about, because oftentimes as eye practitioners, we're looking in the eyes and the patients have no idea what we're looking at. Now, if you look at these slides, there are two slides. The one to the left is what a nerve looks like normally. So when we look in the eye, this is what we're looking at. We see that roundish surface in the center, that's the nerve. And you see all those reddish cords, those are vessels that bring blood and take blood away from the nerve. And so on the left side, the nerve is normal. The picture on the right side shows a very pale nerve because of pressure. So that eye has excessive pressure, which is pushing back the nerve. So I beg your pardon, the blood supply, not allowing it to come in. And that's why you see that nerve is eating into and looking pale. So this gives you an idea of what we mean when we look in your eye and tell you have glaucoma.
Okay, thank you very much for that visual representation, Ma. I feel like it gives us more insights as to what you've been talking about. It puts a picture to it, a face to it, sort of. Okay, yes. So initially, you mentioned that glaucoma is a group of diseases. So that means there are types of glaucoma.
That's right.
Yes.
That's
So
right.
what are the types of glaucoma?
So it's a technical thing for us. It's our task as practitioners is to look at the person with glaucoma and determine what type of glaucoma they have. So I can just briefly tell you about what, it may not make much sense, but just for you to know, there's angle in the eye. And I mentioned about the drainage angle for the fluid in the eye. Yeah, so this angle can be open or it can be closed. So you can either have an open angle glaucoma or what we call an angle closure glaucoma. Now, the open angle is by far the commonest anywhere in the world, and it's also the quiet one. The angle closure, when we talk about symptoms, we'll talk about the angle closure and how it can give you sudden symptoms, but the commonest is open angle. So this angle is open, but it's partially blocked, and so you're not getting enough drainage. Yes, and so that's the angle closure type is much more common in Oriental people, amongst the Far Eastern population. But open angle, generally worldwide, and in our environment in Nigeria, by far the commonest is the open angle type of glaucoma. And just to mention that glaucoma can happen not only in adults, it can happen in children. And so there's a completely new classification of glaucomas we refer to as congenital glaucoma, which means the child is actually born. A brand newborn baby can be born with glaucoma. So it's important for people to know this as well. So it's not just an adult's disease.
Okay. Okay, thank you very much for that, Ma. Thank you for that. So, after all you said, what are the risk factors for glaucoma? What predisposes people to glaucoma?
Yes. So when we talk about risk factors, these are things that make it more likely that a person might develop glaucoma. They're not like sacrosanct. It's not that if you have it, you will definitely have glaucoma, but you want to be looking more closely at people who have these characteristics. The first risk factor, one of the very strong ones, is family history. Glaucoma is basically, most of the time, it's a hereditary thing. And so there are many reasons why it might not be obvious to people that it's an inherited characteristic, but it is by far the commonest, what's most important for us, the fact that there's family history. So if a person has family history of glaucoma, then it means that you should be looking more closely at that person because they may have inherited that tendency. The other thing is short-sightedness. If a person is short-sighted, it predisposes you to the commoner type, which is the open angle glaucoma. Those who are long-sighted might have angle closure, but it's like I said, it can swing either way, but it's well recognized that short-sightedness is a predisposing factor for glaucoma. Also the race. People of Afro-Caribbean origin are more predisposed to having glaucoma. It comes in them earlier, it can be more aggressive, and also more blinding. And so there's the racial predisposition. Of course, I mentioned also that there's a type of glaucoma called angle closure. The Asians, the Far East Asians, Chinese, Japanese population, the Orientals, they're more predisposed to having this type, certain characteristics in their eyes. Also, if you have high eye pressure, but you see, I mentioned that glaucoma has to do with high eye pressure, but eye pressure alone in itself does not cause glaucoma. I beg your pardon, does not equal to glaucoma. If you have high eye pressure and it's not damaging your nerve, you don't have glaucoma. You just have high eye pressure. And so, but we know that if your pressure is high, compared to another person whose pressure isn't high, your tendency to develop to cross over into glaucoma damage is higher. And so we also recognize that it's a risk factor. There are people who can have high eye pressure for years and never damage their nerves, but we know they have a higher chance. And so this is another risk factor. Also, if you have certain vascular diseases, if you're hypertensive, if you're diabetic, if you're a sickler, all these predispose you to having glaucoma. They're also recognized as risk factors. And then injury. If you have injury to your eye, this can cause a secondary, that's not the hereditary type of glaucoma, that is an event that has secondarily led to pressure in the eye. And so these are the major risk factors that exist. Family history, the race, and then let me not forget age. I did mention age. The older you get, the higher your tendency that you might develop glaucoma. So if you look at people by age groups, see that people above 40 have a higher prevalence compared to people who are younger than that. And so race, age, the fact that you have family history, being short-sighted, having injury, or having a vascular disease, these are all recognized risk factors for glaucoma.
Okay, thank you very much for that, Ma. Yes. So the next question will be, what are the symptoms of glaucoma? Like, when should someone be worried?
So glaucoma, it's very important to know that for the commonest type of glaucoma that exists, the first symptom is absolutely nothing. And this is important to know. It's a quiet disease, painless, totally painless. A lot of people have the impression that if they have high pressure in their eyes, the eyes will ache them. That's not true at all. Pressure does not give you pain for the commonest type of glaucoma. And that's the problem. That's why we refer to this disease as the sneak thief of sight, or some people call it the silent visual extinguisher, because the blindness just seemingly sneaks upon the person and they never knew anything was wrong in the first instance. So the first thing to know is that it's silent, no symptoms whatsoever. The first set of symptoms people would have, they would have hayward glaucoma for 3, maybe almost 4 years, and it would be blurry vision. So a person might come to you and say, look, my vision looks smoky or hazy, cloudy, you know, that would be most of the time the first symptom. And like I said, by this stage, this person has damaged almost 70% of that nerve already. And gradually the vision, then they start to lose the periphery of their field. You see, when you talk about vision, you can talk about vision in terms of sharpness, that's acuity. How sharply can you see? Also, in terms of width of field, how wide out can you see? Because acuity is no good without field. So if you, because no matter how sharply you can see, if you have a disease that eats away at the periphery of your vision until all you have is a tunnel, you still can't ambulate. You can't move around. We have a slide, if you might put up the second slide that depicts this nicely. Right, so now this slide shows you how the view of a person, the vision, progresses, you know, as the glaucoma leads to blindness. So the picture on the extreme left shows, you know, probably the earliest symptom. And like I said, at this stage, this person's probably haywarded for like 3 years, maybe more. You can see in the periphery of that view, very slight darkening. And then you can see as you progress to the pictures on the right, you can see that it continues to constrict the field, how wide out the person can see. And so people end up with tunnel vision and they can't walk. They're essentially blind because there's no, you know, you can see sharply only in the center. Everywhere else is dark. And so people like that are walking around and bumping into objects because they can no longer see what's to the sides. And even that gets extinguished over time. So you can have absolutely total darkness. And so it's important to know that the first symptom is nothing, no symptom at all. And so people need to be checking their eyes. We should get worried even when our vision is good. We should check because it's quiet. There's no pain. The vision appears to be good. Only a check at the ophthalmologist will reveal that a process is already going on. The person will only appreciate it later when it's got into these latter stages. So that's important to know. Having said that, let me just quickly touch on the other type of glaucoma, which is the angle closure type, the one that's relatively uncommon. That's the one that comes in episodes. That angle closure is very dramatic. It closes, there's a really sharp rise in pressure, and the person has redness, pain, really blurry vision at that point in time. Sometimes the episode aborts itself, and so the vision rolls back again, becomes clearer again, and the person is no longer in pain. Or sometimes the person would have been relieved in hospital with medication. And so this is an intermittent sort of glaucoma, but I want us to concentrate on the silent one because that's the one that doesn't call attention to itself. That's the one that really potentially can cause blindness. The other one, because of the episodes, would have been diagnosed in hospital when the episodes come up. So we need to know largely it's asymptomatic, largely.
Okay. Yeah, so thank you very much for that, Ma. So usually if an individual waits till glaucoma knocks on his door until they start saying the darkening, the creeping darkening,
we've lost 70%
already.
That's right.
So it's not like malaria, it's like other diseases. By the time you know that, by the time the symptoms present, you're already
right. Yes.
Yeah. Wow, that's very scary. That is very. All right. So, are the available treatment options? So
yes, treatments. There are various methods of treatment. It can be medical with medication drops, mainly eye drops. traditionally tablets or many eye drops. It can be laser treatments. There are different indications for this, and it can be surgery as well. There's no gold standard about what to be done. What it is that it's highly individualized decisions. So the practitioner would look at the individual and work out for the person's age, stage of disease, level of pressure, and all that. What's the best, option going forward? And so it's the ophthalmologist who will decide what best suits you and when to change from one form of therapy to the other. So, but basically, it can be medical, laser, surgical, or a combination of any of these. So basically, that's what we need to know about treatment. So treatment is possible, but let me quickly put it in its proper perspective. Treatment does not get rid of glaucoma. At this point in time, there's no cure for glaucoma. But we can prevent blindness from glaucoma by using treatment. So if you treat, you're controlling the damage such that the attempt is to stop or limit the damage to where it was when it was diagnosed. What you've lost already, but the treatment needs to be able to attempt to keep what you have left. And how successful this will be is determined by many, many interrelated factors, but not least the control of the pressure, which is where the treatment aims at. And so it's important to know that you can control it, but there is no cure. So it's lifelong treatment. You don't stop. So that's important. And follow-up is very important. People start treatment, sometimes they get lost to follow-up. So they're not seen for a year or two, and that's because patients gauge by what they can see. So we have to do detailed counseling, let people understand that this treatment is not to bring back what you've lost. It's only to stop you from losing the rest. Now, a lot of patients get despair when they feel that the provision hasn't changed, and so they stop attending their follow-ups. As far as they're concerned, they're wasting their time. But what inevitably happens to such people is they return to you worse, sometimes now actually at the doorstep of total blindness, because they had abandoned their treatment, or they continue to use the same drug, which somewhere along the line stopped working because there's something called tolerance. A drug that was working for you ab initio can stop becoming as effective as it used to be, and it needs a change. But you cannot take this decision on your own. You must be at the doctors, because only an objective measure with our tools of the pressure will tell us if the pressure is still satisfactory. So it doesn't matter whether your pressure is 10, 20, or 50, your eyes will feel the same. And so only an objective measurement can tell us that it's time to switch you from one drug to the other. Otherwise, you might just be using a drug that's no longer controlling pressure, and again, the damage continues. So it's important to know this. Different treatment modalities, treatment is for life. You don't ever stop.
Okay, so your treatments, they're frequent. You have to keep going back to check with your health provider.
Yes, that's right. At intervals, 3 monthly, 4 monthly, that will be determined by, the practitioner.
Okay, okay. Earlier, you mentioned something about congenital glaucoma.
Absolutely, that's right. That's glaucoma in the newborn. Yes, we see cases. The process of what you call organogenesis, the development of organs, different organs in the body, is very complex. Sometimes something goes wrong. And so if you have, in that area of the eye where you have the filter that I talked about, where the fluid filters out, if you have an anomaly, something or the other, many complex different factors, illness, genetic factors, all sorts of things that could, or even drugs, that could alter, sort of interfere with the normal development of that angle of the eye. You might have a newborn baby whose angles are not filtering properly. And so they're already accumulating excess fluid in their eyes and having pressure in the eyes as a newborn. And typically when you have such children, they have what you call ophthalmos. The eyes look large, really large, larger than you'd expect for a newborn, because the coats are soft. They're newborn, their tissues are soft. So pressure is like blowing into a balloon. So the pressure, the eyes would expand, and then the black would almost totally occupy. You expect to see black and white at the edges. It'll almost totally occupy the whole space, and it will look hazy. It just strikes you as abnormal. But this is because of, abnormal development of the the segment of their eye. And so, yes, there are cases of congenital, and such children usually need surgery. Medical treatment usually not much of help with them. They usually need surgery to help them augment the drainage in their eyes.
Okay. Okay. Thank you very much for that, Ma. Yes. So following up on the treatment, are there what advancements would you say have been made? What commendable advancements have been made in the treatment of glaucoma?
Right, like I mentioned earlier, the most recognized factor at play is pressure, high pressure, and therefore treatment is also sort of directed, towards reducing pressure. And so there are all sorts of eye drops. The research never stops. Newer and newer eye drop groups are coming out every day, just to make it more tolerable for the patients. More effective drug delivery systems. So people use eye drops. Some eye drops are 2, 3 times a day. That affects your quality of life. And so they're constantly developing drugs to try to see if you can, reduce the frequency to once a day drug, make it really convenient. There are already drugs like that now, or even drug delivery systems that may involve either using some sort of contact lens or a plaque that can slowly deliver the drug over time, so that you may not need to use the drug more than once a month or once in 3 months. So there are such delivery systems being developed. So it's all aimed at increasing compliance with therapy so that you can have more success with therapy. Even surgeries are beginning to tend towards what you call minimal invasive glaucoma surgery, which means that really it's a surgery, but really minimally invasive as to not really, adversely affect your life. So you have a surgery, you can go back to work the next day, So, and yet it helps you with the drainage. And so that's really where, things are being developed right now towards more effective drug delivery systems. And studies never stop. Every day, genetic engineering, people are looking at possibility of gene therapy, since we know that it's a hereditary problem. Is there anything you can do to interrupt that cycle that would lead to a person developing glaucoma? So that's like possibility of prevention, but this is very much into the future. Well, hopefully the near future. But research continues to go on. Right now, there's no cure for glaucoma. The drugs that exist are for control, but the systems are being improved to make them really minimally inconvenient to use and yet deliver effective therapy to the patients.
Okay, yeah. So I feel like I've following up on what you said. I feel like thanks to those advancements, to even be easier to follow through with the treatment.
Absolutely, yes. Compliance improves greatly.
Yeah, exactly. Okay, so thank you. I think next question is, as individuals, what intentional things can we do to prevent glaucoma? Is there anything in our power, or is it totally out of our will, out of our power? We just sit and wait. Is there anything we can do on our part?
I'm happy you asked that question, because we need to differentiate between glaucoma and glaucoma blindness. Okay. Like I said, most glaucomas are hereditary in origin. If you want to strictly talk about prevention, you want to prevent the secondary types, the ones that have an event that leads to the glaucoma, like injury. You want to protect your eyes at work, during sports, avoid combat and things like that. So that would reduce, glaucomas from injury. You want to avoid self-medicating when you have a red eye, because when people have inflammation in their eyes, the eyes are red, everybody just assumes they can go to the pharmacy, get a drug, put in. No. Not every red eye is an Apollo, the common name for a conjunctivitis. For a viral conjunctivitis, you go and have it properly treated. Some people have an inflammation that will later cause glaucoma. So this again is preventable in a sense, because you can get proper eye treatment to avoid a complication as glaucoma. Also, people who take steroids. Steroids are a group of drugs that are abused sometimes. So if you abuse steroids, it can cause glaucoma. So if you avoid the abuse of steroids, you can avoid glaucoma. So these are examples of how you can prevent glaucoma, but these are not the commonest causes of glaucoma. The commonest glaucomas are the hereditary ones. And there is nothing about a hereditary problem. That's a matter for destiny, I'm afraid. So destiny will inevitably take its course. So if you're going to develop that glaucoma, you will. The question though is, should you go blind from glaucoma? That's the question to ask here. Because that's why we're saying, what do you do with a disease that doesn't show itself until you're already on your way to blindness? It's quiet. The only way is to check your eye. If you have a habit to have your regular eye checked, and if you're talking about glaucoma, what's ideal is every 6 months, have a glaucoma screening, or worst case scenario, once a year, get a clean deal, says you don't have glaucoma. And so if you do a yearly or twice yearly screening, you will happen upon a glaucoma very early when it comes. So early diagnosis, and then accept the diagnosis, and then get onto seriously religious treatment. Be very religious with your drug therapy, with your follow-ups. Hopefully, you can prevent blindness. So I hope we get the difference. You may not be able to stop yourself developing glaucoma, but you can stop yourself going blind from it. There are people who have glaucoma for a decade, 2 decades. They're still doing well because of early diagnosis and because of targeted treatment and good follow-up. That's what we can do. That we must get our eyes checked. That's the only way to happen on an early glaucoma. If you wait for it to show itself, you've already lost 70%. The rest is an uphill struggle. So that's it for the prevention.
Okay. Thank you very much, Mara. So if I heard you well, I mean, well, prevention, most of the prevention or most of the effective prevention is going to be towards regular health eye screening.
That's right.
Prevent the secondary or the glaucoma blindness. So while there is little or so much we can do about the glaucoma itself, we as individuals can actually take it into our hands to prevent the glaucoma blindness. Wrapping up, what would you say the take-home message for our audience is on glaucoma?
Yes. So basically, know that glaucoma exists, it is real, and it can cause irreversible blindness. Know that it is silent and needs to be discovered before it shows itself. And know that blindness is preventable if you get early and regular treatment with good follow-up. So you don't have to join the statistics. And I pray that, none of us encounters this. Blindness is a terrible thing.
Yes, it is. Yes, it is.
The eyes are the most important of the senses. I say that with no fear of contradiction. So don't be left without your sight. Check your eye today and make sure you do that regularly every 6 months.
Okay, thank you very much, ma'am. Sure, many people agree. Blindness, the eyes are like one of the most. I don't say, but you just can't do without them. I think one time I went to an eye hospital and then they dilated my eye, my pupils, and my vision was blurry for like
4 or 5 hours.
Yes.
And that was terrible. That wasn't blindness.
Yes, that wasn't blindness. It was terrible.
Yeah.
It was terrible. So, and if you're out there, if you're watching, thank you for staying tuned. I hope you have picked up some things. I hope you share with your family. Even if you think this might not be of use to you, share with your loved ones, share with your family. You don't know whose eyes or whose sight you might save by this simple act of sharing with them. Thank you again for watching. Thank you, Ma, for gracing our event. And if you have any questions, or comments, or you can just drop it, or personal questions for Dr. Halima, you can just drop it in our comment sections, and we'll be sure to relay it to her and give you the answer promptly. Okay, so have a nice day, Ma.
Thank you. Same to you. Thank you.
So till we see again next time, have a wonderful day, guys, or evening, whenever you're watching this. And don't forget that you can also head to our channel to watch our other videos on Amazon, the Amazon and Afripreneur series. Till we see you next time. Bye.
We are not here for food. Gaskia.
The family has concluded that you forget this building with your children.
It's still this inheritance issue. My in-laws are bent on taking everything from me because my children are girls.
If you ask me, I would advise you better listen to them and do what they say.
Muhammad Rasulullah sallallahu alaihi wasallam.
I will deal with them.
Doctor had to heed to the family's directive, or else.
Or else what?
Have you ever thought of me writing my will?
Will? How? Where? What's wrong with you? Are you okay?
He did not write a will because he didn't know he was going to die.
Writing my will doesn't mean that I want to die.